Are you preparing for a nursing interview? This comprehensive guide will take you through the top 24 frequently asked questions in nursing interviews and their well-thought-out responses. 1. Tell me about yourself and why you chose nursing as a career. As an empathetic and dedicated individual, I've always had a strong desire to help others and make a positive impact. This led me to choose nursing as a career. I believe nursing isn't just a profession, but a vocation that requires passion and commitment. My journey in nursing began when I volunteered at a local hospital during high school. The experience of providing care and comfort to patients deeply moved me and confirmed that nursing was my calling. As a nurse, I have had the opportunity to work in different departments, serving patients with various health conditions. Each experience has taught me valuable lessons and made me a better healthcare provider. I strive to continuously learn and improve, and I am confident that my skills and passion will add value to your healthcare team. 2. What do you think are the most important qualities of a good nurse? A good nurse possesses a combination of critical thinking skills, empathy, and strong communication abilities. They need to make quick decisions under pressure and maintain a calm demeanor during complex situations. It's also vital for a nurse to be empathetic and kind, creating a comforting environment for patients in their care. Lastly, strong communication skills are essential for interacting with patients, their families, and the rest of the healthcare team. 3. How do you handle stressful situations? As a nurse, stressful situations are inevitable. My approach towards dealing with stress is a blend of staying calm and strategic planning. Firstly, I remain calm and composed, as this not only helps me to think clearly but also reassures the patients. Secondly, I prioritize my tasks to ensure that the most critical tasks are addressed first. I also find it essential to take short breaks when possible, as this helps me to refresh and refocus. Communication plays a critical role in handling stress effectively. I make sure to maintain open and clear communication with my team, which helps to manage expectations and avoid misunderstandings. Lastly, I believe in self-care. Outside of work, I engage in activities that I enjoy and that help me to relax and recharge. This way, I can return to work in a refreshed state, ready to face any stressful situation. How would you handle disagreement with doctor about patient's care plan? In situations where I disagree with a doctor about a patient's care plan, my primary focus remains the well-being and safety of the patient. Open communication is crucial. Therefore, I would approach the doctor professionally and express my concerns, referencing specific observations and facts about the patient's condition. My intention would not be to confront, but to advocate for the patient and ensure we are providing the best possible care. If the disagreement was not resolved, I would follow the chain of command in our workplace, escalating the issue to a higher authority if necessary. Cooperation and respect between all healthcare professionals is key to effective patient care. 4. What are your strengths and weaknesses as a nurse? I believe that one of my core strengths as a nurse lies in my ability to communicate effectively with patients and their families. I am attentive and empathetic, which allows me to understand my patients' needs and concerns. I'm also highly organized and detail-oriented, which helps me manage the demands of a fast-paced clinical environment. My area for improvement would be my tendency to take on too many tasks at once. I understand the importance of delegation and am working to improve on this aspect. 5. Where do you see yourself in 5 years? In 5 years, I see myself working as a nurse practitioner, specializing in pediatric care. My goal is to gain more experience and knowledge in the field of nursing, especially when it comes to taking care of children. I envision myself being a mentor for the new nurses, sharing my experiences and guiding them to become better healthcare providers. I am also interested in conducting research and contributing to the improvement of nursing practices. I believe that continuous learning and improvement are essential in the nursing profession. I want to be a part of the advancements in healthcare and make a difference in the lives of my patients. 6. Describe a challenging patient situation you faced and how you handled it. I once cared for an elderly patient with dementia who was extremely agitated and non-compliant with his care plan. Recognizing that his agitation was likely rooted in confusion and fear, I took steps to establish trust and rapport. I spoke calmly and clearly, maintaining eye contact and using simple language. I also involved his family members in his care when possible, which seemed to comfort him. By showing patience and empathy, I was able to effectively manage his care while ensuring he felt safe and understood. I believe this approach demonstrates the importance of emotional intelligence in nursing. 7. How do you prioritize tasks when caring for multiple patients? Prioritizing tasks is an essential skill for a nurse, especially when caring for multiple patients. I start by assessing the needs of all patients in my care. The assessment is based on the urgency of medical needs, the severity of the patient's condition and the potential for a condition to deteriorate if not immediately addressed. I also consider the wishes and preferences of the patients. After the assessment, I start working on the tasks that are most critical for patient safety and health. I also continuously reassess the situation, as medical conditions can change rapidly, and I may need to adjust my priorities accordingly. I also utilize time management skills to ensure that all tasks are completed in a timely manner without compromising patient care. 8. What experience do you have with electronic health record systems? I have extensive experience with various electronic health record systems. During my nursing training, I used simulation-based programs, which prepared me for real-world scenarios. In my previous role, I regularly used the Epic system software. I am comfortable using these systems to track patient information, manage care plans, and communicate with other healthcare professionals. This experience has helped me streamline my workflow and provide efficient care to my patients. I am also quick to learn new systems if required. 9. How do you stay up to date with the latest developments in nursing? I continuously seek knowledge to improve my skills as a nurse. Reading medical journals, attending seminars, and participating in workshops help me stay informed about the latest advancements in nursing. Additionally, I have joined several professional nursing associations that provide regular updates on new research, best practices, and changes in healthcare policies. I also make it a point to network with fellow healthcare professionals to learn from their experiences and insights. This thirst for knowledge keeps me at the forefront of my profession and allows me to provide the best possible care to my patients. 10. Describe your experience working as part of a healthcare team. As a nurse, I've had the opportunity to work alongside a diverse group of healthcare professionals. This has included doctors, nurse practitioners, physician assistants, and various specialists. I've learned that each member plays a crucial role in ensuring the patient's well-being and recovery. My role involved collaborating with the team to develop and implement patient care plans, carrying out physician orders, and communicating patient progress. I've also coordinated with other nurses for shift changes and patient updates. This experience has honed my skills in communication, teamwork, and patient care. It's taught me the importance of every team member's contribution towards holistic patient care. 11. How would you handle a situation where patient refuses treatment? Considering the criticality of the situation, I would first try to understand the reasons behind the patient's refusal. It might be due to fear, lack of knowledge, or cultural beliefs. Having a calm and compassionate conversation can help in addressing their concerns. Empathy and patience are key in such situations. I would provide them with all the necessary information about the treatment, its benefits, and potential risks. If the patient is still not convinced, I would respect their decision while ensuring their safety is not compromised. If necessary, I would also involve the supervisor or the patient's family to ensure the best possible outcome. 12. What would you do if you witnessed a colleague making a medication error? In such a scenario, I would first ensure patient safety is not compromised. I would notify the colleague about the error discreetly, avoiding any unnecessary embarrassment. If the error has already occurred, I would immediately inform the charge nurse or supervisor, depending on the severity of the error. I believe it's crucial to have an open and honest culture in any healthcare setting. It allows for errors to be used as learning opportunities, rather than being hidden, thereby potentially improving patient safety. 13. How would you comfort a distressed family member of a patient? When dealing with a distressed family member, my first step is always to ensure that they feel heard and understood. I offer reassurances about the quality of care their loved one is receiving and try to provide clear, concise information about the patient's condition and treatment plan. If they have questions or concerns, I address them with empathy and patience. In these situations, my goal is to foster a sense of trust and open communication. This can go a long way toward alleviating their anxiety. Also, I would refer them to available resources, such as counseling services or support groups, that can provide additional help during this challenging time. 14. What steps would you take if a patient's condition suddenly deteriorated? If a patient's condition were to suddenly deteriorate, my first action would be to stay calm and maintain composure. I would then quickly assess the patient's status, checking vitals, pain levels, consciousness, and other signs of distress. Promptly, I would alert the attending physician or medical team, providing them with a detailed report so they can make an informed decision on the appropriate steps to take. I would also ensure the patient is as comfortable as possible, reassuring them that we are doing everything we can to help them. Additionally, I would update the patient's family, if appropriate, to keep them informed and provide emotional support. 15. How do you handle ethical dilemmas in patient care? When facing ethical dilemmas, I first try to understand all aspects of the situation. I consider the patient's wishes, the medical guidelines, as well as the possible outcomes of different decisions. I consult with colleagues, supervisors, or the hospital's ethics committee for advice or suggestions. Ultimately, my goal is to respect the patient's autonomy while ensuring their safety and welfare. My decisions are guided by my professional duty and responsibility to the patient, and I strive to find a balance between these sometimes conflicting principles. It can be challenging, but I believe that open communication, empathy, and a respect for the individual's rights and dignity are essential in resolving these complex issues. 16. Why do you want to work at this specific hospital, healthcare facility? Having done my research and knowing the values this hospital stands by, I feel it aligns with my personal nursing philosophy of providing patient-centered care. A strong reputation for clinical excellence, coupled with a commitment to continuous improvement and innovation, draws me here. I believe my skills, passion, and commitment to quality care will be a valuable addition to your multidisciplinary team. I can contribute to your ongoing efforts to provide the best care possible. 17. How do you adapt to working different shifts? Adapting to working different shifts is essential in nursing. It's all about maintaining a healthy lifestyle and a strong mindset. Proper nutrition, regular exercise, and ample sleep are crucial to keep my energy levels up. When I know I have a night shift, I adjust my sleeping schedule ahead of time to ensure I'm well rested. I also make it a point to stay hydrated and take short breaks when possible to keep myself alert and focused. It's also helpful to stay organized and plan my tasks and responsibilities efficiently to manage my time effectively. I believe flexibility and adaptability are key in this profession. 18. Describe your ideal work environment. My ideal work environment is one that promotes team collaboration, where each member values and respects the contributions of others. It is a place where continuous learning and development is encouraged, and every individual is committed to providing the highest standard of care to patients. I thrive in settings that offer challenges, paving the way for growth and improvement. I believe that open communication is essential, fostering a harmonious work climate. A supportive management that acknowledges and appreciates the staff's hard work is also important in creating an ideal work environment. As for the physical aspect, a well-organized and clean area contributes to the effectiveness and efficiency of the nursing care provided. Adequate resources and equipment should also be readily available. It's crucial to have a safe working condition, adhering to the guidelines and protocols established. This kind of environment promotes not just the well-being of the staff but also the patients we care for. 19. How do you maintain work-life balance in a demanding profession like nursing? As a nurse, maintaining a healthy work-life balance is crucial. I achieve this by adopting efficient time management strategies, such as organizing my tasks, delegating when necessary, and making sure to prioritize self-care. I also ensure to set boundaries between my personal and professional life. This means not bringing work home and dedicating time for relaxation and activities I enjoy. I believe that a healthy work-life balance not only improves my personal well-being but also enhances my efficiency and productivity in the work environment. 20. What do you think sets our facility apart from others? In my research about your facility, one thing that really stood out to me is the comprehensive approach to patient care. It's not just about providing medical services, but also about ensuring the overall well-being of patients. The focus on patient-centered care, the effort to create a positive and supportive environment, the incorporation of advanced technology in healthcare delivery, and the emphasis on continuous learning and professional development for the staff are all features that I believe set your facility apart from others. 21. How do you ensure patient confidentiality in your daily work? Patient confidentiality is of utmost importance in nursing. I strictly adhere to HIPAA regulations and the hospital's policies on patient privacy. I avoid discussing patient information in public areas. When accessing a patient's medical records, I ensure it's done in a secure and private location. I only share information with authorized personnel who are part of the patient's care team. If a family member or friend asks for information, I politely explain that I'm unable to provide it due to confidentiality rules. Patient trust is crucial in nursing, and upholding their privacy rights helps foster that trust. 22. Describe your approach to providing culturally competent care. In providing culturally competent care, my primary step is always understanding and respecting the cultural backgrounds of my patients. I make it a point to educate myself about different cultures, beliefs, and practices, as this information aids me in delivering personalized and effective care. Active listening is a crucial skill I employ to understand the unique needs and concerns of each patient. I also take into account the impact of culture on health behaviors. This means being sensitive to cultural beliefs about medical treatment and illness, as well as overall health practices. I strive for open and honest communication, ensuring that I provide information that is clear and comprehensible, respecting language barriers that may exist. I believe that understanding cultural competence in nursing leads to better patient outcomes and satisfaction. 23. How do you advocate for your patients' needs? I advocate for my patients by first ensuring that I understand their needs completely. This involves active listening and empathetic communication. It's essential for me to build trust so they feel comfortable sharing their concerns and needs. Once I have a clear understanding, I use my professional judgment and knowledge to guide them or make suggestions for their care plan. I maintain open communication with the healthcare team, discussing and suggesting interventions that best suit the patient's needs. I also ensure that patients and their families are informed about their rights and options, supporting them in decision-making. I believe patient advocacy is not only about speaking up for patients, but also about empowering them. 24. What is your understanding of evidence-based practice in nursing? Evidence-based practice is a critical aspect of nursing. It means using the most current, relevant and reliable research in making decisions about patient care. This approach ensures that the interventions and treatments provided are both safe and effective, improving patient outcomes. It requires staying up to date with the latest research, being able overall to analyze and interpret the data, and then applying it appropriately in a clinical setting. This approach also emphasizes the importance of considering the unique needs and preferences of each patient. Hence, evidence-based practice in nursing is a balance between scientific evidence, clinical expertise, and patient preference. We hope this guide on the top 24 nursing interview questions and answers has been informative and beneficial to your preparation for your upcoming nursing interview. If you found this video useful, please like and subscribe for more valuable content.